A lot of foreign doctors practicing in the UK, they practice under a kind of undue, what is it called, pressure.
Right.
Pressure of not making mistake. I won't lie to you, some of the biggest tech gurus in the world are Nigerians. Nigerians are tech guru. An average Nigerian guy is a tech guru. But they do not have that platform to work.
Right.
I have a friend that says if he doesn't eat Peter Cola, he doesn't get his body. So they will buy a back concussion.
Yeah.
They're going to take it. When they take it and it's not working and the damage keeps going, at the later stage of the of the illness, they are now being forced to go to the hospital. Do you know if there is an emergency and you go to the hospital, it is your right for you to be attended to?
It might be your right, but the reality is a different thing entirely.
There is no accountability in Nigeria.
Right.
And that is the big problem. There's no accountability. The moment accountability starts taking place in Nigeria, everybody will sit uptight. And Nigeria is the country that believes so much in status. They love status. Don't you know I'm the CMD of this place? You know, I can't tell you. So all those kind of little habits, very bad habits in terms of cultural habits, it has affected and eaten into our DNA so much that when we come abroad, we find it very challenging. Like, you know, there are some people, there's nothing you tell them. Their faith is so strong that they'd rather die than go to the medical ways. You understand? So as a doctor, you should be able to talk your patient into taking medication or treatment that you know is of benefit to them. The problem is, a lot of all these migrants, when they come, they're working for two. When I mean two, they're working to establish back home, and they're also working to be established in the UK. Now, an average British person just want to be comfortable in the UK. So they don't need to work to the level a migrant will work. A migrant wants to make money to live a good life in the UK like a British. They also want to make money to take back home to live like a good life like a king.
Hi guys, welcome to another episode of the Rearview podcast. My name is Crofty, and as always I have another amazing guest on today's episode. He is a doctor practicing in the UK but with a lot of experience in Nigeria, and he has so many stories to tell us. We're going to be taking the discussion from many angles, so you really want to stay back, sit tight, relax, and stay tuned with us on this episode as I introduce my guest, Dr. Benga, on the show. Dr. Benga, welcome to the show.
Thank you very much.
Thank you so much for sparing your time to have this wonderful discussion with us. Yes. So let's just start from the beginning. Why did you become a doctor?
It's a long story, but I'll make it as short as I can. Okay, actually, to be frank, I wanted to become a computer engineer, a computer scientist, but I remember my dad telling me, you don't need to really go to school to achieve that. Why don't you give yourself something more challenging? And I looked at it and I said, okay, let me do medicine. So I got into medicine, and I'm this kind of person. I love humanitarian services, and the closest thing to that is medicine, and also the fact that my dad was a doctor. And that actually inspired me. Like, I've been in the medical line since I was a young child. I remember then there were some expensive medicine my dad would keep in the house. He won't live in the hospitals just to prevent people from taking it. So we would send one of the nurses to come and get the medicine. We just say, okay, give them metronidazole. So at that young age, I had a lot of knowledge. Awareness about healthcare and medicine as a whole. So that inspired me, and I studied medicine.
Okay, so instead of computer science, you went for medicine.
Yes.
And did you study medicine in Nigeria?
Yes, I did.
Okay, and just generally, what was your experience like of studying medicine in Nigeria?
Medicine in Nigeria. I think things have changed. Like I was put it in this way. My experience. When I went to medical school, it was a different ball game.
Yeah.
During our time, there was more of strike,
Yeah.
not as much as the 90s. Though there was still a little bit of strike, and I actually went to a private medical school, so it was pretty much straightforward. But there were a lot of challenges in terms of accreditation. A new private university getting everything done and stuff. So accreditation was quite an issue, but overall, the experience wasn't bad. It was actually a very nice experience, and I enjoyed it.
Yeah. Okay. That's interesting. Because, it makes a difference if you went to a private university. Because I guess some of the challenges you would experience with like federal or state university may not have been present.
If you say that in Nigeria, during my time, I always say during my time because that's the time I can actually speak for.
Yeah.
The medical school were not really affected by the strike. They tried to make the medical school an independent department from the school as a whole. It's not that strike does not really affect, but they try to make use of the time of the strike.
Yeah.
To like maybe during the strike time, they give it as that should be the time to go and study.
Okay.
And immediately you're coming back, you're starting your exam.
Yeah.
So they give all the lectures.
Yeah.
Then they use that time to give the medical student to study.
Yeah.
So the strike didn't play a major role, in terms of what's it called? The
just your experience of education in Nigeria.
Generally, medical schools in Nigeria are quite stable.
Okay. Oh, that's interesting to know. Yeah. Okay. So then you graduated and then you became a doctor.
Yes.
Yes. Okay. So just talk about so I guess I want to know, was practicing medicine in Nigeria as a doctor, was it what you expected? I know your dad was a doctor, so you kind of had some idea of what to expect. But given like the generational gap, what was that like for you eventually qualifying and becoming a doctor?
If you, now let me say my general experience practicing in Nigeria is quite very, very, very lovely, I won't say. Because I remember when I finished my medical school, then we need to write that's a medical and dental council exam. So there was this like 6-month gap, but I was able to work with my dad then under tutelage, like mentoring me.
Okay.
So I was able to do, to like gain that experience before I wrote my exam. So after I wrote my my MDCN and I passed and everything, I got my I started my house job. They call it housemanship. Yeah. At Lagos State Health Service Commission, and I won't lie to you, that's a very, very, very interesting place to do house job because it gives you access to a lot of things. Is owned by Lagos State, and one of the few places that is being run by Lagos State Health Service Commission is the Island Maternity. I don't know if you've heard of it before.
Right, yeah.
At Isaleko. They call one Massive Children Hospital.
Yeah.
Those two places, if you work there as an house officer, the amount of experience you gain there is too broad. And
so is it quite competitive to get into those places?
Very, very. In Lagos State, you have 3 main, I think, few places where you can do your house job. Right. But the 3 most competitive places, LUT, Lagos State Teaching Hospital. I can imagine. LASUT, Lagos State University Teaching Hospital. Yeah. Then, what was it called? The Health Service Commission, which was the place where I did my house job. Yeah. So those 3 places are extremely competitive. Yeah. So it was quite tough. You have to write the exam, you have to pass the interview. Yeah. Then there are other things too. They consider if you are a Lagosian, that also helps you, if you're born in Lagos.
Yeah, it helps you to secure.
Because those are some of the things that can streamline the number of people that get into the place. Because if not, I don't think they have the capacity to take the number of people
that really want to get in there as for training. For training. Okay, so you're born, bred, trained, educated
in
Nigeria, and now you're here in the UK. And what's automatically like shouting out to me is, obviously the brain drain of you're just one of many Nigerians
Guilty as charged.
that falls into this category.
And I feel bad about it, yeah.
Do you feel bad?
I
Or
won't
should
say
you feel bad?
No, I shouldn't feel bad because
Yeah.
when as you know, I can't tell for other profession, but as a doctor, yes, money plays a key role. It's very good, very important. I won't lie. Yeah, money is good. You know, to be well compensated for your efforts is very good. But if you ask every doctor, I can tell you 9 out of 10 will tell you, in as much as those things are actually bonuses, the actual fulfillment of a doctor is to render service.
Yeah.
An average doctor, like in terms of like a normal doctor, as I said, 9 out of 10, when you see them, they say, yeah, the money comes in early and everything. But the most important thing is to render services. And when you render services, it gives joy when you achieve results. So, in terms of that area, you need a platform to be able to deliver.
Absolutely.
And unfortunately, during our time, that platform keeps falling.
Right.
The standard keeps dropping. I won't blame it on anybody. I think everybody have their own role to play, but I think the government has a major role. Okay. In terms of ensuring this platform is actually there for doctors to work in. And if those platforms are not there, then that's the first factor. Then the second factor is the work ratio to the benefit ratio is so terrible. Doctors work so much back in Nigeria and earn so little. Not even the earning, benefit so little. Right. So there's no compensation for the effort. And because of this, and there's no platform to deliver. So when you take all these things and you put them together, everybody just want to leave.
Okay, so let's break it down. So you've sort of talked about a different thing. So like the infrastructure, the sort of work environment, so many different things have led to people, different professionals leaving Nigeria, especially the brain drain as we call it. So let's talk about the impact of this brain drain, because I feel like in the last 5 years in particular, so it's not just doctors, teachers, the tech bros and the tech sis, as you call them. A lot of them are leaving Nigeria and many are aspiring to leave. As a matter of fact, many are just waiting to finish their education and then leave. And it's almost like there is danger looming because, I think, I can't remember the statistics now, but I think I was seeing somewhere where there's only one doctor for every maybe it's quite a lot of 10,000 Nigerians or something, something ridiculous like that. And, in a country where medical care is quite appalling, or it's not really accessible to many people. And I don't know if you would agree with me that the medical care is appalling, but we can debate that. But what are some of the dangers that you see looming as a result of brain drain if care is not taken?
The danger of brain drain is high mortality rates. Inadequate, professionals, and economic, breakdown. Yeah. Now, I won't lie to you, the brain drain is extreme. And it falls down to what I've said initially, the platform. Now, the case of Nigeria is a case of a farmer that has is ready to work. But does not have the farm to work. Right. Whereas there are some people that have got the farm, but they don't have the workers to do the work. Right. So in my tradition, they'll say someone that has a head that has a cap and a cap that does not have a head. Okay. So Nigeria has all the professionals, but they do not have the platform to deliver. Now, when there is no platform to deliver, you cannot earn what your work, you can't earn what your work capacity should get.
Absolutely.
So now when you put that together, what do? You look at where there's what's called a platform and you move there. You are walking like the way you should walk. And at the same time, you are making the money. So it's a win-win. Because there's a platform to work.
Yeah.
But in a place where there's no platform, you're putting all your efforts and you're not getting reward for it in terms of monetary or in terms of delivery. When I mean delivery, like you have good surgeon, but when you don't have the good theater
Tools,
unit or tools to perform a good surgery, you are frustrated.
Yeah.
So it's not even just the money alone. And when you're frustrated, you can't deliver, you won't earn good money. So it's a big problem in Nigeria now. Nigeria needs a platform. I keep saying a platform, especially for the professionals. I won't lie to you, some of the biggest tech gurus in the world are Nigerians. Nigerians are tech guru. An average Nigerian guy is a tech guru. But they do not have that platform to work. There's that platform. That platform, I know, yes, money is important, but basic platform.
So the overall infrastructure, that you
bad.
think. Okay, so I'm thinking now then, if danger is looming and brain drain has serious consequences, not just for the government, but for the ordinary citizen of Nigeria, with regards to healthcare, what then do you think the average Nigerian should be doing? Or how do you think they should be proactively taking care of their health to make sure that they don't fall into just to sort of cushion themselves against the looming danger? So because obviously healthcare can be preventative and it can be, what's the other word? Diagnostic.
Yes.
So there's a lot of things you can do to prevent, to make sure you maintain a good health status. You know, of course, we can't all predict what's going to happen to us. People get sick for different reasons. But just from your experience of practicing medicine in Nigeria, what are some of the bad habits, I would say, or some of the things that you think Nigerians just casually don't care about, but actually in the long term, it would help them to maintain a good health status, and maybe cushion them in some way from this impending danger?
Yes. So now that's a very good question. As I tell people, we're all back on the government that government have to do better, but we too as individuals need to do better. Now we are in a country where the healthcare system is poorly, but now I won't blame people, but I blame them because of the socio-economic situation of the country. Now, there is somebody who's got headache, who's got some symptoms of malaria. Instead of them going to the hospital immediately, what do? They give money to go and buy this herbal concussion.
Right.
I have a friend that says if he doesn't eat bitter cola, he doesn't get his body. So they will buy herbal concussion.
Yeah.
They're going to take it. When they take it and it's not working and the damage keeps going, at the later stage of the, of the illness, they are now being forced to go to the hospital. Now you go to a place where the infrastructure is not as solid. What do you expect them to do? Now, you go there, they're like, why didn't you come since? Nigeria will practice what they call preventive medicine.
Right.
We like to tackle the thing immediately rather than wait. Because when you wait too much, we might not have the facility
to treat,
to recover you from that very downside. Not that we can't do it, but we don't like to take risks. We won't like to take the risks. So it's a so the earlier, the better. Early detection. But an average Nigerian does not practice early detection because of the socio-economic situation back home. So what do? Like, this body pain and headache. Now, let me know if I go to the hospital now, they'll be charging me a very large amount of money, like 20,000. Where do I see 20,000 right now? Let me just take 2,000 naira and buy herbs from that corner there. They buy the herbs, they use it. It does more damage. They are forced to go to the hospital. Now, when they reach the hospital, the 20,000, they say, I won't pay. They'll be paying times 2, probably maybe even times 3. Then it becomes a big challenge.
Right.
So those are some of the things. Even we as individuals can do better. Let's not wait until things get bad before we attend to it. Now, one of the situations I'm going to give, sorry to say, an average person who is building his house in Nigeria, at least for you to build a house in Nigeria, it shows you are doing well to a level.
Yes.
You know, how can you be building a house and you do not make room for a gutter?
Right.
I've seen a lot of rich people, they just build houses. They don't have good, proper drainage. Is it the government that will do the drainage in front of your house? Actually, you need to have a drainage system in front of your house to drain. Yeah. So now, like 10 houses here on this road, and the last house, maybe it leads to a canal. If I drain from my own, it drains his own, it drains his own, it drains his own. Everything goes where? To the canal. But when I build my house, I don't even put a drainage. He builds his house, doesn't put a drainage. He builds what happens?
Yeah, there's compound effects of flooding, yeah.
So it's not just only the government. There's a civil responsibility from even an average Nigerians to do the needful. Now, if government sees those things and maybe the drainage gets blocked or get filled up, then you can now challenge the government that who've done drainage.
But you talked about, but I hear what you're saying, but if we bring it back to the healthcare sort of scenario, you actually pinpointed a very important thing, which is the socioeconomic status. Because many people cannot afford the basic necessity, the health then takes a backseat, because it's almost like, okay, let me do what is next for survival. And if I can't even afford a 3 square meal, how then am I going to think, oh, let me quickly go and pay that 20,000 naira for health checkup, for something that I don't even know, maybe a simple paracetamol might have cured it, or maybe this herbal concoction might actually help out. So people are less inclined to want to just, the cash is not just there for them to, whereas when you compare to like other countries where healthcare is free, or the socioeconomic status is not so bad that people can actually afford to go and see their, medical practitioners, then it's a slightly different kind of scenario.
Now, I think another problem we have as a citizen as a whole is an average Nigerian find it difficult to read. An average Nigerian does not want to read a text like. You see, information is very vital to driving the socioeconomic situation of a country forward. Now, I tell a lot of patients, they don't even know their rights. Do you know if there is an emergency and you go to the hospital, it is your right for you to be attended to?
It might be your right, but the reality is a different thing entirely.
But that is the thing. If you have an emergency back in Nigeria, and you go to any hospital, it is compulsory, it's in the law that they stabilize you before they start talking of anything.
But I beg to differ, because then we've had many scenarios where people have been in accidents, or they've had, they've been in very bad situations. Maybe they've been victims of a gun crime or robbery or something of that nature. And we've had many, many instances where they've taken them to the hospitals and hospitals reject them, and they say, go and get a police report. And, then you go to 3 hospitals. By the time you get to the last hospital, the person gives up.
Now it's because they don't know their rights. If there is an emergency and you take a patient to the place, whatever the emergency may be, it is the right of that patient to receive what they call the first aid care. Now, you can always get a police results for further treatment, but if the patient is not stable, it is your right. It is the right of that patient to be stabilized. Now, I stabilize the patient. If I do not have the capacity to carry on with treatment, stabilize, we have to refer. Now, if it comes to the case of police reports, how can somebody who is not stable get a police report?
Well, this is the thing, and this is why many people don't help, because they always put the pressure for police reports on the person who has brought the sick individual to the hospital. And this is why people don't help anymore.
That is why it is always good to know your rights.
So, okay, but if I have a right that is not being given to me, who should I be holding responsible? Because this incident has happened many times, and yet we don't hear that, the hospital was closed down, or this doctor has been arrested for denying a patient treatment.
That is because, sorry for cutting short, that is because there is no accountability in Nigeria.
Right.
And that is the big problem. There's no accountability. The moment accountability starts taking place in Nigeria, everybody will sit uptight. If you take a patient to hospital and something like that happens, and patient passes away because of you're saying go and bring police report or pay a deposit and all those kind of things, and you do not stabilize the patient, he passes away, you can sue. And when you sue, there should be somebody accountable for.
Yeah.
Either the owner of the hospital or the person who is who is on duty at the time of that emergency.
Yeah.
There should be accountability.
Yeah.
Accountability is very vital. If there's no accountability, nothing will function.
Absolutely. And I don't know how close we are to accountability in Nigeria. So I would just say, you're right. You know, textbook wise, that is the answer. We do need accountability, but in reality, I don't know how close we are to achieving that. I want to ask, in your view, what do you think is the biggest cause of, healthcare challenge for individuals in Nigeria? Like if I say a single killer, for example, like something that you think if people were to pay attention to this particular part of their health, there would be less mortality.
The number one, as I would say, is hypertension. Hypertension. You see, a lot of people die in self-denial. I see people saying they've got headache. When they check their blood pressure is high, and I tell them, okay, there's family history. You're symptomatic. There's family history, you're symptomatic, and your blood pressure is high. That's a red flag already. That's proving, and it's not like the headache is just the first time you're having. You've been having maybe those kind of headache, but you've never paid attention, and you check your blood pressure is high. It means you must have been having high blood pressure, which you never,
paid attention to, yeah.
And, you know, self-denial, you see people saying, what you don't know is better than what you know. So they use paracetamol and like, okay, and when they feel better, it maxes the whole situation. They go ahead the activity, then 2 days later, they have another headache. Now, there's what they call chronic illness.
Right.
You've already subjected yourself to chronic illness of high blood pressure,
right,
which eventually will destroy the kidney. Gradually, you're killing your kidney because you're not paying attention to your health. And I won't lie to you, the end stage of this is renal failure,
right,
renal insufficiency, and a lot more. That's the target. That's one of the main target points of high blood pressure, of hypertension.
What is renal failure?
Renal failure is when the kidney just stops functioning,
right,
and does not function the way a normal kidney should function.
Yeah.
For some certain reasons.
Yeah.
A lot of reasons can cause that and eventually lead to the kidney not functioning at all, which is called renal failure. And they have different stages: stage 1, stage 2, stage 3, and stage 4. And there are criteria they use in measuring those stages. Now, you have headache, there's family history, they are symptomatic. Symptomatic, there's family history, and your blood pressure is high. People will be like, no, I don't want to start high blood pressure medication, because they say when you start the high blood pressure medication, you will be on it for life. But if you're already having an illness that needs high blood medication, that requires you to take it for a lifetime, if you don't take it, you've not solved the problem. You're causing more damage. So that's called self-denial. You're causing more harm. Then now the kidney that should have been preserved for a long time, it starts damaging. Yeah. And now when the kidney damaged to a level, the same thing you don't want to be on, you might end up being on even more complicated and complex care.
And would you say this is why, because I've noticed on Instagram or just on social media generally, we get more cases of people begging for donation and really young people as well. So I don't know if this is more to do with hypertension or if there are other reasons for this kidney failures, because I see more cases of young men, younger adults experiencing kidney failure in Nigeria, and they're needing dialysis and they're needing, transplants, all of these different things.
I'm going to blame this thing on 3 things. Number 1, self-denial. Number 2, social media. Okay. Yes, I'm going to social media. And number 3, awareness. Social media is, it's creating like a kind of, attention. Now you see people going on social media taking all kind of medication, drugs and stuff, and social media are trying their own, like all these platforms, they're trying their best to to all those explicit and all those things to cover it, but people still find a way around it to try and podcast and show all these things. So younger generations have access to all this information. So now you see someone saying, let me give an example. They might say, oh, there's a place where they sell chewing gum. These boys, they know chewing gum is not the actual chewing gum we are talking of.
Right, okay.
Like they have a kind of name, a coded name,
For
to give information on social media. And people just find a way to get all these substances and all these things easy, which are actually toxic to their health.
Right.
Now, this social media again, in terms of all these beauty products promotion,
right?
Use all these supplements, use all this drug for weight loss and all those things. Social media are promoting a lot of things, and people have access to it. Unlike in the past, social media was not easily accessible the way it is. You have to be rich, to get. Then I remember when I was younger, to go on the internet, to go and do overnight browsing. That was in the early 2000s. There was no access to on your phone. All these things, all these social media on the phone. It was then I think you have just even one there, Facebook, but now you have loads of social media platforms.
Yeah.
Easy accessibility to social media, and a lot of information are cascaded on all these platforms. So I blame that on social media indirectly. Number two, awareness. I don't think there's awareness broadcasted to people as the way it was in the past. I remember in the past, when we watch TV, you see a lot of adverts on drug awareness, situation of things. I remember when I was younger, NTA would play some kind of adverts, jingles showing that don't take drug, it's bad for your health, all those things. I think now people don't do I feel they're still operating in that format, but the world has evolved.
Yes.
So those adverts, those awareness needs to evolve.
Yeah.
To create more awareness that will be that will be so engaging.
Right.
So that people can be aware of all these things. So I think awareness.
But we live in an information overload time where, just like you said, with social media, people get all this information about all these sort of narcotics and drugs and all these different things that they shouldn't really be taking. It's from social media. But also the same social media also has a lot of information that creates awareness, I would say, about the dangers. Because the thing is, it's very easy to see somebody who has now experienced liver failure or kidney failure because of drug abuse, whereas before maybe, they're sort of hiding in the home and you don't really get to see all of these things. So you might say you don't know. So how much of this is really because of awareness as opposed to other things?
So I want to be frank, I think there's more incident now than before. Because now, because of this world of social media, of this world of everything moving in a fast pace, it is easier for people to access them.
Yeah.
Because you get the information. Like now, you might be living in Grace, you might not know that in the next 3 houses is actually selling some products. But with information now, you just see the address. Oh, man, I've been staying in this Grace and I didn't know the next 2 buildings actually sell this thing. Oh, let me go and get stuff from there, all those kind of things. And in terms of the awareness, yes, this social media will still do the awareness that don't smoke, don't take drugs. But I tell them how intensified is it compared to those days? Those days, I remember that you see banner, don't smoke. Like when you are entering a public place, smoking is bad for you.
Yeah.
You see on the tobacco, cigarette something, don't smoke. Smokers are liable to die young.
But it's still there and people are still smoking.
People still smoke. No. Yes, but I think you just need to do like the awareness to be more bolder.
Right.
I don't think
like
the
a shock effect.
Yeah. I don't think they are making this awareness as bold.
Right, okay.
As it used to be in the past.
Okay.
In the past, people are not scared. People are bold.
Right.
To create awareness. But now, people are like, if I create awareness, they might say maybe I'm too stiff. Maybe I'm not what's it called, moving at the pace, or,
So you think we're too conservative with the kind of awareness we're creating?
Yes.
We need more shocking. We need to see people sort of.
We need to say it the way
at
it is.
the end of their life, showing them on telly.
Yeah, we need to, we need to, as I said, time has changed.
Yeah.
The way you do the awareness then has to be different from now. We have to move with time. But one thing is, we need to say it the way it is.
Okay.
But now, because of a lot of things happening in the world, I don't want to say, a lot of things are changing.
Yeah.
There's now this thing called free will. The free will is now too much that even they're giving children as young as 10 years old free will. I'm not saying children should not have say or should not be free.
Yeah.
But like telling a child that so I don't want to go into details.
And
but
I get what you're saying.
Yes.
And of course, with free will comes a lot of responsibility as well.
Yeah.
So free will without the responsibility is dangerous.
It's very dangerous.
It's dangerous. But I want to talk a bit about social media and something you mentioned, because I know that, and especially as it pertains to Nigeria, I know that there's a lot of sellers or vendors. There's a lot of vendors on social media selling all kinds of concoctions, herbal concoctions, beauty products, like you said, many of them selling like bleaching creams, this one is something for fibroids that is going to kill your fibroids, it's going to kill your substance, something to cleanse your system, something for weight loss, like you mentioned as well. So there's all of these things are accessible. And of course, because there's probably less regulation, I know that, what is this company that regulates NAFDAC is many of these things are supposed to have NAFDAC.
Back in Nigeria. In the UK, they have their, what was it called? I've forgotten the name, but they have their regulatory bodies too.
Regulatory bodies. But talking about Nigeria, do you think a lot of these things also contributes to really the dangers, the sort of damages that people are causing to their bodies? And
you're right. You already answered the question.
Yeah.
When you have a lot of all these vendors selling all these things, on social media, and they are not properly regulated, what happens? People have access to it, like now, let's say I do like a short advert, like today, just leave it for like a week, and I take it off, maybe to advertise something like cleanse your skin with, or maybe there's this thing they say for raw manpower to help you get sexually active and stuff. All these things, I don't lie to you, because these are not pharmacies, or these are not products that have undergone series of tests to be sure that it's actually safe to the body.
Yeah.
These are just raw products that people have come, mix herbs together and start selling in an industrious, amount.
Yeah.
Why? What is the end result of all these things? Profit,
yeah.
At the detriment of the consumer's health.
Yeah.
And now, when the consumer does not have proper information, or is not properly aware, or does not have, the knowledge, adequate knowledge, or literacy, they resort to things like this, and eventually it kills them. Most time, it destroys their kidney, it destroys their liver. And now you see young adults in the age of from, let's say 40, even you see young children
even younger,
young as 30, having kidney problem already. It's because of the exposure to all these drinks, all this herbal concoction, all in the name of it's cleansing the system. Rather than you go and waste loads of money in the hospital, this concoction goes for, like, I'm just giving an example, 1,000 naira, rather than you spend 10,000 naira. Use it,
Dr. Benga,
and you get better.
Dr. Benga,
I know.
Our forefathers took herbal concoctions.
Yes.
They drank Undue as we know it. Yes. So, is there a place? Because I want to be mindful. I don't want it to look like we're demonizing herbal or are we demonizing herbal concoctions? So, is there a place for Undue and all these herbal concoctions?
Now, the difference between your forefathers and our own time is, if your forefathers want to take Undue, he will not go and buy it on the street.
Okay.
He will go to the farm. He will get the leaves himself. He will grind them. He knows what he's using.
Right.
And he will take it.
Okay.
But now these people don't go and source for the leaves. They don't even know what they're taking. They just go to all these local vendors that have mixed different things and they take it. So it's a different ball game. There's a difference between somebody who actually goes there, get all the raw material that they know is actually safe for them, use it, than for someone that is going to buy from someone that's already mixed it. What if they put cannabis inside? You know, majority of all these concoctions have cannabis in them.
So are you saying, so are you then saying it's okay if I know the herbs that I'm mixing together, if I go to the original source, and you know, I get all the leaves together and do, is there a place for that?
Now, the reason why I would say do not try that is, you know, when a pharmaceutical company is trying to make medicine, when they take a leaf, they'll do like a research on the leaf. Oh, this leaf is very good. It's going to cure, high cholesterol. But when it cures high cholesterol, does it cause any danger? Oh, if this leaf cures high cholesterol, it can actually, the long-term effect of this leaf can actually lead to blindness. It's actually curing something, but it's causing something else. So what can we do to prevent that blindness that is going to cause? Then they'll say, okay, let's take another leaf. When they take this leaf and they mix it and they do the research, they'll say, oh, okay, when you mix this leaf to this very good leaf, it's going to help. It doesn't have effect on the effect of the effect it has on the cholesterol. It still does a good job on the cholesterol by lowering it. And this leaf actually helps the leaf to prevent the blindness. Okay, instead of taking this leaf alone, we'll take it and mix it with that one. Then use it to provide the medicine for the cholesterol. But now when you just take herbal concoction, you don't know, you just take only that one, bam. And you take it for a long time. Your cholesterol is going down, but you just discover you wake up one day and there's blindness.
And I totally agree with you on that point, because I think that one of the blessings that Africa has, and Nigeria in case in point here, is we have so many natural remedies, natural herbs, access to, you know, just a lot of natural things, but there hasn't been enough research and development into these things to create them in a format that we can easily consume and say, you know, so all these herbs and stuff, we don't have enough doctors or research scientists going and doing research and then eventually producing them into a capsule or tablet or even a liquid, whatever, to then say, okay, now you can use this. So you're not necessarily demonizing herbs and concoctions. You're just saying that we haven't done enough research into them.
You can't take something you've not researched.
They
are not bad. They're actually, definitely, most of the drugs are made from plants and leaves and whatever. But taking it without researching it, without knowing the side effect, the adverse effects, can actually become something that is meant to be of benefit, can become a thing of harm. So now, as I said, I keep going to the to what I've said in the earlier on. Platform. Nigeria has the if Nigeria have the natural resources, the human resources, but they do not have the platform. Now, you have good scientists, you have all the resources that good scientists can use to produce the best medicine, but there is no platform. And what is platform? Number one, infrastructure. Number two, basic amenities. Now, all these natural resources, you want to manufacture and you want to do stuff, you need good, good power supply. Till today, we still complain of blackout.
Honestly.
They see 80% blackout in majority of the places in Nigeria. So those simple little things. So now, how can companies, even small companies can't survive in Nigeria? Because when you look at the overhead, it's not worth it.
It's not working. Okay. So let's move on then, and it'll be interesting to then talk about your experience in the UK. So we've talked about brain drain, and of course what that means is that people are leaving Nigeria and they're looking for other pastures to greener pastures to practice their profession. So a lot of Nigerians, as I know, are moving to either Canada, UK, the USA, Europe, even Saudi Arabia, even India to practice, to become doctors, right?
To practice medicine.
To practice medicine, right? And so, given that you are now a doctor practicing in the UK, I want to talk about your experience, because I guess, you know, sometimes there's this sort of romanticizing of like, I'm finally leaving Nigeria. Now I'm coming to the land of the land of milk and honey. And then you arrive in the land of milk and honey, and then you realize that it's actually not all that you thought it was going to be. What were some of the shockers, I would say, for you, just before you even go too deep, just on the surface level? What were some of the shockers for you as a doctor?
One of the shockers to me as a doctor in the UK is in the UK, you know, I remember back in Nigeria, like when I go to work in the morning, as early as 8 I finish maybe around 6, 7 in the evening. I still go and hang out with my friend to watch football. Maybe if there's Champions League, I'll still have that time, and I'll go home, wake up, and still go to work for that time. But in the UK, when you finish working, the only thing in your head is to go home.
Right.
Because your brain is exhausted.
Okay.
Now, the UK, don't get me wrong, it's good, but it's not the milk and honey. It still has its own major disadvantage. Now, a lot of foreign doctors practicing in the UK, they practice under a kind of undue, pressure.
Right.
Pressure of not making mistake. Pressure of, I've just left. I want to make a living for my family.
Right.
I don't want anything to take my pin away. They are not expressive. Most doctors in the UK are not expressive. You cannot challenge anything, even though if you know it's for the benefit of the patient or for the institution. Because of what reason? Because you're scared that anything you do contrarily might actually have impact on your, on your personal well-being in terms of your finance and other things. So you tend to work under pressure. Now, when you work under pressure, a job of 2 hours looks like 20 hours. Now, in the UK, when I mean working under pressure, like, you see a lot of doctors saying, oh man, I've just come to the UK to work, do my bit, and just earn money and let my family live well. You know, as a doctor, you know, I tell you something, the fulfillment of a doctor is to yield results. The money is good, but there's a stage you reach as a doctor that even with the money, you still feel, I just need to give more. And it happens to majority of the doctors.
Right.
We just want to give. Now, when you come to a place where the setup is a bit different, because I won't lie to you, it's different from the setup in Nigeria. The setup in Nigeria and the setup in UK is different. There is this kind of challenge, like, should I express myself? And when I mean express yourself, I'm not saying you should do anything contrary to the guideline.
Right.
I mean, you should work according to the guideline, but you should be able to make suggestion, and you should be able to point out things, and, you know, be able to discuss with your superior, with your bosses that come. Yeah, nice guideline, I've said this, but, you know, when I was reading, when I was doing this, I'm thinking, will this patient not benefit from this? Why don't we try? There's nothing we'll lose from trying. A lot of doctors won't say that. A lot of doctors just say, you know, let's follow the guideline. If it doesn't work, it doesn't work. If it works, good. So when you see people like actually foreign trained doctors who have come to the UK working in that kind of orientation, the job becomes boring. It becomes draining, because everybody's joy is to be expressive in their workplace.
Right.
But I know a lot of people complain about, this work, because a lot of foreign trained doctors, they complain about this institutional racial things
bias.
and stuff. Yes, bias. And they are scared.
Right.
So they don't want problem. So they just want to work, do the needful, what they're meant to do according to the books, and go home.
So they're working under like great restrictions, and not just restrictions because you want to do the wrong thing, or you just want to behave anyhow.
It's just working under a platform of treading carefully, not doing more and not doing less. Just do what they want and get out.
Just enough to get by, enough to say you've done your job, and you go.
But that, let's be real, that is not enough, because if that is the platform which our forefathers has been trending on, a lot of all these new development, new generational medicine, they will not come into place. So a lot of foreign trained doctors, they find that challenging when they come to the UK, especially in the first phase of their working experience. Maybe as they become consultant in the UK, yeah, it's a little bit better, but still some are still scared. So all those challenges mixed together, you realize that, wow, I wish there's a platform like this in Nigeria where I can work, earn money for my services, and just stay back home.
But which one is safer for the patient? So I hear what you're saying. We've just earlier on, we talked about the lack of accountability in many areas in Nigeria where, you know, doctors have been responsible for a lot of lives being lost due to negligence and stuff.
Negligence everywhere.
Absolutely, but the rate of negligence, or the level of negligence, or the amount of time the negligence is occurring is not quite the same, would you say?
I won't call it negligence back home. Rather, I will call it just infrastructure and what should I call it? General poor state of our facility. I don't think it's the doctor's fault in most of the cases back home. I just think it's the whole situation of back home. Yeah, they will call it negligence, but sometimes it's not really negligence. There's negligence everywhere in the world. Yeah. Even in the UK, there's a lot of negligence everywhere. Every country has negligence.
Yeah.
You know, but every country just try to manage their own what's called situation. Unfortunately, as I said, lack of the accountability back in Nigeria makes it very difficult for them to manage.
Yeah. So every country has negligence. You're absolutely correct. But the kind of negligence I'm talking about, I'm sure there are cases where it's just like the doctor just hasn't had enough compassion, or they haven't cared enough. They haven't listened enough to their patients. So when you were talking about some of the challenges that you think a doctor in Nigeria might experience moving abroad, one of the ones that comes to my mind just from reading online or from hearing people talk about their experiences, like just the basic bedside manner of like when a patient...
Don't worry about the bedside manner. Our people back home, when they transit to, let's say, to the UK or to abroad or any of the other, what's it called, Western country, there is a big problem. Because... Tell us more. cultural background.
Yes.
You know, we are raised in the country whereby respect your elders, obey before complain. So that kind of orientation back home for your elders, you know, is part of the things that's even drawing us back.
Yeah.
So because of that, you see people back in Nigeria, and Nigeria is a country that believes so much in status. They love status. Don't you know I'm the CMD of this place? You know, I can't tell. So all those kind of little habits, very bad habits in terms of cultural habits, it has affected and eaten into our DNA so much that when we come abroad, we find it very challenging. Like now, let me give you an instance. Like a matron who has been a matron back in Nigeria for years, I won't lie to you, their bedside manner matron back home is quite funny. And I don't want to go into details. When they come to the UK and they see situation like that, you know, because of the cultural background and everything, they just say something like, why are you screaming? You're not the only woman that will give birth.
Yeah.
Something like that. But everybody is different.
Exactly.
You know, so if you don't learn to work on yourself and to improve your interpersonal skill when you come to you'll be in a lot of trouble. And that's why some of our people, when they come to the UK, they're always in a lot of trouble, because the UK, the way the cultural setting is, the way the system works, is so different.
Yeah.
You can be in the hospital in the UK, you see a 13-year-old person will come in and will call you by your name. Maybe you're wearing your sticker. It will just call you Dr. Mac, or Dr. Benga, or Dr. Edward, or even call you Benga. You know, back home.
Because if they call you doctor, there's still respect.
Yeah,
at least
they'll even call you Benga.
Yeah,
they'll call you Benga. Then they'll be like, why don't you have respect? You know, it's not that they don't respect you, but there's difference in cultural, cultural background.
Expectations,
And our people sometimes it gives them a lot of problems. It gives them a lot. Our people.
And especially the part of like, when the patient is asking you questions regarding their health, like
now,
you've told them, and they're asking questions, and are you the doctor?
It's a big problem to have. And I have a lot of people, when they go back, when they call me from Nigeria, they'll say, oh, I went to so hospital, I was asking the doctor what medication I'm using, and the doctor said, I don't need to know. That's crazy. It
Yeah.
is the right of a patient to know what is wrong with them.
Yeah.
The medication you are giving them, the treatment you are giving them, it is their right.
Yeah.
But you know, back in Nigeria, people will say, but in the UK, it is their, if a patient you ask you question and you cannot provide them the question regarding their own health. I'm not saying any other thing, but their own health, the medication they are using, what you are treating them for and what you think is wrong with them. By law, it is wrong.
Yeah, absolutely.
It is wrong. It is their right. It is the patient's right.
But then they come to this country, and because of all the rules and regulations and everything in place and the accountability and the consequences, they sort of have to fall in line. Although they might struggle, and some people fall through the net and they do get sort of, you know.
And that is where the struggle is. And that's why I say when they come to the UK, they've just worked for like 8 hours and it looks like they've worked for 20 hours. When they finish, you hear, oh my God, I barely survived the hospital today. A lot of things that then they go back home.
Yeah.
So in the UK, it's draining when you work as a doctor. And now in the UK, so I'm going to talk, the NHS is not as easy. Now in the UK, they practice what they call diagnostic medicine. It's a good kind of medicine. In Nigeria, we practice preventive. Like we're scared that if this thing goes out of hand, we might not be able to tackle it the way we might be. But in the UK, I'll use UK because that is my place of residence. In the UK, they practice diagnostic. They feel, don't worry, let's wait. Let's be sure of what is going on before we start treating you. Yeah, they might start with some basic treatment, but they will actually need to investigate thoroughly. Sometimes the investigation now, because of the overload on the NHS, it might take longer than expected.
Yeah.
So now, those are some of the challenges now you face as a doctor in the UK. In the UK, you have to wait. It is not expressive. Now, you have to ensure you do all the investigation. You have to follow the NICE guideline. If you don't do the investigation, even though you suspect this is what it is, you cannot do anything until you've checked. Now, if the check is going to take time and you feel, let's start, the patient will benefit from starting early. If anything goes wrong, the fact that I did not wait for the check to come out before you commence, you will be out for it. Even though what you've done is not actually the primary cause. When coroner investigates or forensic, they will actually call you and you must be accountable for that. So those kind of little things makes it very, very tricky too in the UK, you know. So they've still got their own flaws. Back home, we have our own flaws. And we also have the good part of the preventive medicine, just trying to like be aggressive from the start. Yeah, it might not be the best approach, but
you've had instances where like people have said in Nigeria they got diagnosed with like cancer or something. Maybe, I don't know if that's part of this preventative medicine where they're just trying to go for the biggest thing first, and then they go somewhere else and they're like, you haven't got cancer, you've just got something different. In medicine,
there's what they call differentials. Differentials diagnosis is you come with your symptom and we like these symptoms can present in 3 different ways: cancer, malaria, and typhoid. Now, in Nigeria, you just hear, that thing they said, Nigeria will even pick the biggest one. The patient to pick the biggest one. They said it is cancer. God forbid. And because of that, sometime again, I'll say something too. The socioeconomic situation, some doctors, not all, few doctors, they profit out of things like that. Now they'll be like, okay, let me just say cancer so that they'll pay more. You know, those things are not good. That's not actually nice. But because of the socioeconomic situation of the country, it can be like that. Whereas in the UK, if you attempt that, you're going to jail for it.
Absolutely.
Because there's accountability. So all those things put together, you won't say one place is better than the others. But the only thing the UK has got going for them over Nigeria is accountability and platform to work.
So holistically, I know you said you wouldn't say one place is better than the other because they all have different things going on for them. But if you had to choose holistically, which one do you think is better for a patient? Has a better patient?
The UK. Let's be real. In as much as they might have their flaws. Now, you just take it. Nigeria might have 20 flaws. UK might just have just 3 flaws. So which one will you go for?
The difference is clear.
Yeah, it is clear, but not that they don't have.
Of course, no one is perfect. There's no perfect country.
If you say so, but just that our own flaws are more. There's no accountability. Everybody going on a rogue. everybody are all rogue. Everybody just doing what they want, nobody to account for them. And so those things are pretty much very difficult. And I won't lie, from my experience too in the UK, I noticed that a lot of, I'm going to give example, like in the UK, in the obstetrics and gynae place, I noticed that, I came to the UK and this was one of my observation. A lady came down, why is it that most black children in the UK are now coming with childbirth deformity and all those kind of things, having all these different syndrome and all. And I said, really, genetic, idiopathic. Idiopathic means we don't know the actual reason, but it can just happen, genetics. What was it called? Child formation, child malformation. But still, I realized that the pattern of treatment of our antenatal in the UK for a black person, because they have to follow the guideline, I don't think is 100% suits the Afro-Caribbean race. Like now, when I was back in Nigeria, I went for a seminar and I went for some, seminar and other things, training. And, it is actually required of a black Afro-Caribbean woman to take 2 milligrams of folic acid. Okay. Daily during first trimester of pregnancy, just to help prevent any kind of genetic malformation and deformity, But in the UK, they tell you are okay with your prayer care. And prayer care has just, I think about, is it 80 microgram or 60 microgram? I don't know. But it's not adequate enough. Right. But for a normal Caucasian lady, that is more than adequate. Right. All those small little things. And that's why when a lot of our people come to the UK, like our women, and they eventually get pregnant and give birth, those little things actually are very, very important, and they add up. And they add up. So those are some of the challenges too we see in the UK.
That's an interesting one you've just said, actually, because I think the statistics, there's a statistics about 5 times more. So like black women are 5 times more likely to experience a sort of mortality when it comes to like childbirth, and this is actually a campaign that's currently going on in the UK.
Yes, because they need to adapt the guideline for antenatal and also for childbirth. Definitely we are like visitors. Yeah. We should be the one to accommodate them. Like, you understand? Just when you're a visitor and you go to somebody's house,
you have to adjust to their house. Yeah.
But in the process of you adjusting now, if the owner of the house sees the adjustment is causing you harm, they can also help to adapt to adapt some things, modify some things, so that it doesn't affect you. So there has to be a compromise. Yeah. They have not compromise. No, there's no compromise in medicine. There have to be a review. There have to be a platform to help, in terms of the Afro-Caribbean lady, the black women, to prevent all these things and just to make them feel included in the system. So that's actually a big area too. Yeah. Okay.
I guess finally, just to round up, I want to talk about, what do you think is the place of faith and religious belief in how people look after their health? So I know, like in Africa, in Nigeria, there are lots of charlatans, and there are lots of like religious leaders who pray, I would say, they pray on innocent or just unassuming, the unwise, who, they just say to them, you go to them with a report from the doctor to say, oh, my doctor has said I have XYZ illness, and they say, oh, that's the doctor's report, it's not your own report, and you must pray. And don't get me wrong, I do believe there is a place of faith, and there's a place of, individuals praying and whatever your belief system is, but I'm speaking specifically about the sort of just the blatantly unwise and lack of education, and all these decisions that are derived from just deception, a lack of education, and a lack of awareness, where some religious leaders would prevent their congregation from seeking medical help Do you think this is an issue, or it's not as common?
It's a very, 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 very big issue, especially in Africa, in South America, and in some part of Asia. You see, religious belief has killed a lot of people. I'll give you a scenario. There's a woman who is hypertensive. She went to a place of worship, and they said her blood pressure is high, but they said she should dance it away. So she kept dancing, praying and stuff, and eventually the lady collapsed.
Wow.
When she collapsed, instead of them calling the ambulance, they first started prayer for her. Pray. When they saw the case was getting bad, they now called the ambulance. The lady eventually died as a result of that. Now, if the family of the lady say, Pastor, why didn't you wake this person up when this person collapsed? What will they say? They'll say it's her time.
Yeah.
Or something.
Yeah.
So now, a simple taking the lady to the hospital at that time would have solved everything.
Yeah.
So now, I don't want people to hide under the religious belief of if I pray it out, if I don't use any medication, it's going to get sorted. Now, let's go. I'm also a religious person. I have my own beliefs, but it doesn't interfere with my healthcare. I tell people the reason why you are aware of your health, of all these health challenges and all these health situation is because God wants you to know, so you can pay attention to it.
Yes.
If He doesn't want you to know, He won't let you know about it. Anything you know about, the reason why you've known is because you need to be aware of it and to take actions when needed.
Yeah.
If I have headache, I won't say, let me go and say the Lord's Prayer. Oh, I have headache. Let me take paracetamol. Let me pour water on my head. Let me relax. And if it doesn't go, I go to the hospital immediately if it's continuous. But you know, when you say, oh, this headache, oh my God, it's just disturbing me. Let me go to the church and go and pray, or let me go to the mosque and go and do prayers, or go to my shrine or my high priest to do prayer. The time it will take you before using paracetamol to walk from your house to that place, you might collapse. You know, see, my people die from what? According to
they suffer for the lack of knowledge. Or something like that. Yeah.
My people die perish.
Yeah.
From lack of understanding. That's why all these people are perishing. Because they do not have the basic impact. And the reason this has happened is all these pastors and religious leaders, there is no accountability.
Yeah. And there's a lot of exploitation.
Yeah, and it's exploitation. You will notice that in the UK, the US, Australia and stuff, it is not as rampant, because if a member should come to your church and they confirm to you they have headache and you do prayers for them and their family know and they collapse, no matter who you are, being a pastor, an imam, or whatever it is, you go to jail for it.
Yeah.
So they are very peculiar. But you know, in all these other developing nations, it's a bit tricky because there's no accountability.
Yeah.
Oh, the patient has died. It's time for the patient to go.
Yeah.
So those are some of the things.
Yeah.
You know, knowledge is power. I tell people, you have this knowledge not because you just have it, but it's because the reason is to give you awareness.
Yeah. And knowledge and medicine is not the enemy here.
No.
It's like God has given us this knowledge
He's
and
giving us the
doctors
knowledge
and experiences to actually help.
Yeah.
I always see everything sort of works together.
I tell my patients this. I know you want to go to the church. Why don't you go to the hospital, start medication, then let your pastor come there and start praying for you? So instead of doing one, why not do two?
Do both, yeah.
Combine the two so you get quicker results.
Exercise your faith that the medicine will work.
Faith that the medicine will work. Let the medicine be doing its own. Then let your faith be doing its own. Rather than doing only that faith and leaving our one aspect.
Yeah.
So if you do the two together, you yield results. So, I try to cajole them into something like that so that, there are some people, there's nothing you tell them. Their faith is so strong that they'd rather die than go to the medical ways.
Yeah.
You understand? So as a doctor, you should be able to talk your patient into taking medication or treatment that is of benefit to them.
Okay, so just to pick up on, we talked about people moving to the UK. So not just doctors now, but just immigrants generally. What is your advice? Because I hear a lot of stories also in the news of people coming and then they just collapse and they pass away, or they start to experience different health challenges that they just did not have before. So what would be your advice to people who are coming or who are moving abroad in terms of the things they should be taking note of in terms of their health, the diet, just lifestyle? Because everybody wants to make this money and they want to make it quick, and that has consequences.
Now, for what you've said, it is a big challenge. It's a big challenge for migrants. Now, the problem is, a lot of all these migrants, when they come, they're working for two. When I mean two, they're working to establish back home, and they're also working to be established in the UK. Now, an average British person just want to be comfortable in the UK.
Yeah.
So they don't need to work to the level a migrant will work. A migrant wants to make money to live a good life in the UK like a British. They also want to make money to take back home to live
like
a good life like a king. My advice is take things easy. Take things easy. When you fall down and go, life goes on.
Absolutely.
All the luxuries you're accumulating, you're trying to work just to accumulate, to make, at the end of the day, it will become useless. I tell people, you need to set your priority right. Some people, a lot of people, their what's it called? Their dream is bigger than their reality. It's good to think big, but you need to think in line with reality. You know, your dream, is the reality we used to have that big dream. But some people, they are not having the big dream to align with their reality.
Yeah.
Now, you're in the UK, you work as an healthcare worker, a band 3. You want to build a big mansion in the East. You also want to buy a house in the UK and be paying your mortgage. There's a cap already. Now, you're not thinking of, okay, let me go to nursing school, or let me even go and study medicine to up my salary. This is the cap, okay. In order to break this cap, I'll just work extra hours. You are not being realistic with your goals. You understand? So a lot of time you see all these our people when they come in, like all these migrants, when they come abroad, they work impossible hours. Some people will tell me they're doing 12 hours, 6 days a week.
That is crazy.
Now you're coming doing 12 hours, 6 days a week. Why? In order to meet the demands of the lifestyle you are projecting in your mind. Some people, is not actually the lifestyle they're projecting. It might be family matters.
Expectations. Pressure.
Some people have a lot of family back in Africa where they have to live. So like they are working for like different people.
Yeah.
You know, the black tax. When I make my money, I want to send to my mom, my dad, my younger sister, my cousin, my this. You know, sometimes they are not necessary, because at the end of the day, if anything happens to you, life goes on. They move on to the next person.
And go on.
And that is why I tell them that, please. And again, there's a problem too in this migration thing. You see these people, they come to the UK, they have headache. They're like, if with this headache, if I tell my supervisor I've got a headache, they will say I shouldn't come to shift like 2 days. I should go and see the GP. They'll take the shift off me. I need the money. So what do? They'll just manage themselves, go and come back to the shift the next day with this bad, terrible headache. Now, when anything happens to them and they collapse, the family, no. So sometimes you don't need to give yourself those kind of pressure. It's very common. Be realistic with your goals. Be very realistic, and you need to pay attention to your body.
So sometimes it's not your village people. It's actually just you,
just
not
the individual,
being careless and not paying attention. And there's something about the diet as well. I don't know how much of a big deal this is, but of course, like, back home in Nigeria, or just in Africa generally, you're probably eating a lot more naturally sourced food. I know that, of course, there's a proliferation of like a lot of junk and a lot of like, I don't even know, food that have come from different places. But of course, you come to the UK or you come to the West, and the diet is also vastly different, where there's a lot more sugar, there's a lot more junk food. Do you think that plays a role at all in the health?
It plays a role, very important role, but I don't think it's more of the diet.
Right.
The diet is very key. Yeah, you can say the diet, but it's not like the diet effect. It's more like what are you taking? Now I'm going to give you a very major example. Most people who have migrated from the sub-Sahara region of Africa, when they travel to to this Western world, like the US, the UK, Canada, they start falling sick more frequently. They'll say, oh, I don't used to fall sick when I'm back home. But now they'll start falling sick. And I tell people, do you know the melanin requires sun?
Right. Absolutely.
And now, there is what they call the vitamin D syndrome in migrants. When you leave a place where sunshine is in abundance, you don't need to eat food rich in vitamin D as much because you get a lot from the sunlight.
The sun directly.
But when you come to a place where, I've not seen sunlight today in the UK. When you come to a place where the sunlight effect has reduced drastically and you are not getting the amount of vitamin D you should get from the food, what happens?
There's a deficiency.
There's a deficiency. Immune system will drop. Things start happening to you. So people need to start looking at the diet in terms of not necessarily just the food, but what is contained in the food. And again, as you've said, the junk, it plays a major role. There's access to junk back in in the Western world. It's very easy. Just go. There's drive-through. You don't need to come out of car. A lot of junky food. Whereas all those things, you don't get access to it in the sub-Saharan region in Africa.
As easily.
So most time people buy their food, go home, cook it, and they eat. But this place, we eat a lot of preservative. And not just because of we want to eat it, but because, as you said, it still falls down to realistic dream. Now I'm working 8 in the morning.
What time do you have to cook if you're working 12 hours?
Now, if I'm working 12 hours, what time do I have to cook? I'll eat on the go. Buy this, eat, go. Buy this, eat, go. And now you are not getting the adequate nutrients. You are not getting what you're meant to get. Eventually, your immune system will break down. Eventually, you are undergoing stress. Your blood pressure will go up. Eventually, you have vitamin D deficiency. When you accumulate all these things, you just see them working one day and they just collapse and they die. And we now say it's our village people. How is it village people here? It's just simple information and knowledge. Your diet, your stress level, and your expectation. Should be very, 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 should be taken into consideration
and well managed.
And well managed to live a balanced life in the UK.
Absolutely. No, that's perfect. Thank you. Thank you so much for all your knowledge, for just sharing with us and pouring out. I think it's been so important to have this discussion, and I hope that a lot of people have benefited from, our conversation, and that they're going to take away a lot of gems and things to apply, especially with what you said with migrants and just with, medicine and health management, generally speaking. So my final question to you then, I guess, is, given all the awareness and knowledge and everything you have, and Nigeria has lost one, but will Nigeria gain you again eventually? Will you be back, go back?
Definitely. I'm a Yoruba descent, and it's what they call Ilela Boko. Now, I'll give you an example. No matter where a British person stays, there's the age they reach, they come back to the UK.
Right.
Me, I'll go back home. Definitely. Yeah, I still want to.
When you're 70?
No. Okay. Sooner than you guys believe.
Okay.
I want to go and give back to my community. I want to go and give back like what I've, what I've gained. Part of this, and that's why I say it's not, when people say brain drain, sometimes it can be brain gained.
The brain is drained to be gained
gained back eventually. So, what's it called? Like myself, my joy is to go back, acquire all what I've gained here, and try and put it into work and practice back home in Nigeria. I plan on doing a lot of things back home, like maybe building a dialysis center, maybe building like a good diagnostic center, not just building it in terms of to make profit, but to make it accessible to the common man. That is the joy. How can we make these things accessible in terms of location, price, and manpower? So those are some of the things that we've learned here want to go back home and want to establish so that the normal common man on the street can have access to quality health. And that is why all of us have migrated out and we'll migrate in back again.
And you jackpada.
We'll jackpada. Yeah, it's called jackpa, then jackpada.
Okay.
To go and give back to our community. And I'm
yeah.
like, there's a lot of Nigeria now, a lot of like minds now in Nigeria, in diaspora, we're like saying, you know what, it's high time we come together as a unit.
Yeah.
And we can, change can start from somewhere.
Yeah.
Let's go back home. Let's be the change.
Absolutely. Like this, you know what they say, every little drop makes an ocean.
Yes.
And where you might feel like, oh, I don't have this big idea and whatnot. It doesn't matter how small your idea is. Just do your own part. If everyone does their own part, then it will eventually come together and make a whole and becomes big. Absolutely. No.
So there's the jackpada syndrome that is happening. And no, it's even happening already.
It's happening already, actually.
Already.
Yeah.
And if you can see, there was last year there was what they call this is it dirty Lagos? Dirty December in Nigeria.
Yeah.
A lot of foreigners, even a lot of people in diaspora were in Nigeria.
Yeah.
I heard Nigeria was jam-packed.
Yeah.
You see, so these are some of the things, let's start from there.
Yeah.
Let them come. Let these people come. Let them have access to good roads, to good amenities, good health. All these things before, people will be like, why am I going back? Let me just steal, man, enjoy all these things. Let me steal, man, I can make more money from home. I can give back to my community. My community will enjoy it. Then everything will now be reserved back for the country.
Yeah.
So that's my own take on everything.
Perfect. Well, Nigeria, Dr. Benga's coming back. Not sure when, but watch out for him.
Very soon.
But no, thank you so much again for joining us on this episode. Yes. And guys, my name is Crofty. I remain your favorite host on this episode, on this podcast. Please do make sure you like, you subscribe, you share, tell your friend to tell a friend to tell a friend, and join us again on another episode where I'll be coming your way with more interesting conversations and more interesting guests. Until next time, bye-bye.
Take care.